For more on this, Bertha Madras joins us from Belmont, Massachusetts. She's a professor of psychobiology at Harvard Medical School. Bertha, thanks for being with us. We see how many people are getting addicted to these drugs through prescriptions. How much of this crisis starts on the prescription pad?
Right now, it's about 65% or less. It used to be about 90%. But more and more people are initiating drug addiction to opioids with heroin instead of prescription drugs. Prescription drugs are a part of the problem. The biggest problem we're facing now is fentanyl.
So you're saying that number is only going down because people have essentially traded this drug for another?
Well, I don't think they've traded. About 67% of people who are becoming addicted to opioids are starting with heroin, whereas in the past, the majority of people addicted were starting with prescription opioids. So the scene has shifted. It shifted from legal drugs to illegal drugs and from heroin to fentanyl in terms of overdose deaths.
So President Trump has stopped short of declaring this a national emergency. He's still called it he's still calling it a national health emergency. But what's the best way for the government to help fight this epidemic?
I think there are many ways for the government to fight the epidemic. I was one of the 6 commissioners that the president appointed to develop recommendations. We developed 56 recommendations. He accepted all of them. He allocated more money for this crisis than any previous administration. We have to remember the crisis really began dramatically in 2010 when the overdose death rates shot up exponentially. The way to solve this problem is first and foremost to get as many people into treatment as possible. That is not a simple matter only of dollars and cents. One of the biggest problems we have is that 70% of people addicted to opioids do not show up for treatment, do not even request treatment. That's one of our major challenges. We have to be able to develop better systems to motivate people to seek help, and then we have to increase the number of treatment slots and also evidence-based treatment. It's clear.
Bertha, many people are pushing for injection centers, safe spaces for people to consume these drugs and be observed in the case of overdosing. Are these realistic?
I think the answer to that depends on one's philosophy as well as whether or not the evidence is available for proving that or showing that they are effective. At the present time, I don't think we have enough evidence that they are effective. And above all, what we have to do is show that rescuing people from an overdose is also going to help them get motivated and help them transition to treatment. And we simply don't have that data from the current injection sites that we are motivating people into treatment. There clearly are people who are rescued at these sites from overdose, but what happens once they leave? We don't have, in many cases, these injection sites don't keep records. We don't know if they are among the cohorts that are dying or whether or not they're living once they leave those injection sites. But they certainly should be coupled to treatment.
All right, Bertha Madras, incredible the work that you do. Again, Bertha Madras, a psychobiology professor at Harvard Medical School. Appreciate you being with us. Amnesty International says